Hello, Mr. Ash. Hi, my name is Dr. Tayal. Pleased to meet you. Right, I've been asked to talk to you because you've had some problems with your vision. So what I'm going to do is take a history and then examine your eyes and any relevant system, and then we can have a chat. Is that okay?
Yeah, it's all right.
Okay. Do you want to tell me what's been happening? What about your eyes, and what's the main problem?
They water a bit, and sometimes they're a bit blurry, but then, they have days where they're all right,
Does it vary in the day? Is it more in the day, in the morning, or at night, or?
Well, it's more at night when we're getting a bit tired, I think. I don't know whether that does it.
Okay. And with the vision, are there any parts of vision which you can't see? Parts of visual fields that you can't see, or is it just a generalized blurring of vision?
Yeah, it's just a generalized.
Okay.
It's not one particular thing,
Right, okay. Anything else apart from the eyes? Any other problems?
No, not really.
No. Do you feel otherwise fit and well?
Yeah, I feel all right, yeah.
Okay. Any previous medical problems?
I'm a diabetic.
Right.
I've had diabetes for about 40 years.
Yeah.
But that's under control at the moment.
Okay. Any high blood pressure?
No, my blood pressure is fine.
Heart disease?
No.
Thyroid problems? Any thyroid problems?
Well, I had, but they're all right now.
What sort of problems have you had? Thyroid?
No, I'm not aware of what it was.
Okay. Now, do you smoke at all?
Yes.
Yeah. How many do you smoke?
15, 20 a day.
And have you been doing it for a number of years?
Yeah, since I was about 18.
Okay. Alcohol?
Occasionally, I don't drink a lot.
Okay. Medication-wise, are you on any regular medicines?
Well, I'm on insulin.
Yeah.
And statin for my cholesterol.
Yeah, so you have high cholesterol as well.
Yeah.
Okay. Anything else?
Not really, no.
No. Now, you mentioned the thyroid trouble, which you're obviously not aware of. What was it in the past? Do you have any bowel complaints or diarrhea?
No.
Do you have any tremors or do you feel
shaky.
sort of anxious and shaky? No.
No.
Have you had any weight loss recently?
Not recently, no. It's fine at the moment. I'm pretty steady weight all the time.
So you've had some weight loss in the past?
Yeah.
Okay. When was that?
Oh, when I was about 26.
Okay. And do you know why it was? Were you told what was the reason for weight loss?
Yeah, they said it was a thyroid.
It was a thyroid then?
Yeah.
Okay, right. And at the moment, do you have any problems walking upstairs, any weakness in your arms or legs?
No, fine.
You're okay, all right. Are you on any thyroid treatment?
Yes.
What are you on?
I take 2 pills every day.
Of thyroxine?
Thyroxine.
Okay, fine.
I think it amounts to 150.
150 of thyroxine.
Yeah.
Okay. Okay, so we'll go ahead and examine you. Okay, Mr. Ash, so I'll be just looking at your face and eyes now. Right, what I'm going to ask you to do is, this is a glass of water. Take a sip, keep it in your mouth, and take it, swallow it when I ask you to swallow, yeah? So just take a sip and keep it in your mouth. Yeah, okay, and swallow now. Okay, if you keep the glass there, okay, and again take a sip, keep it in your mouth, and swallow it now. Alright, that's fine. Just tip your head back for me. Okay, that's fine. Is it sore anywhere on your neck?
No.
Just going to tap on your chest if that's okay. Can I have a look at your hands? Right. Can you stretch your arms for me like that? Okay. That's fine. Just going to check your pulse. Okay.
Okay, you have 2 minutes remaining.
That's fine. I'm just going to have a look at your eyes, if you don't mind. Yeah. Can you see my finger? Yeah. Just keep following this finger wherever it goes. Don't move your head. If you see doubles at any time, just let me know, okay? Keep following my finger. Do you see doubles at any time?
No.
Okay, keep following my finger. Don't move your head, please. Again, we'll start again. Keep following my finger. Okay. And again, look at my finger and follow it. Do like that for me. Keep it there, don't let me push it down. Okay, so that's pretty strong. Well, thank you so much. Now that I've examined you, we just have a quick chat about, what we need to do next. Right, Mr. Ashes, after looking at you and, listening to your story, you've obviously got quite prominent eyes, what we call exophthalmos.
Yeah.
And I think that's related to your thyroid condition which you've had, and it has been treated appropriately by the surgery. It's called Graves' disease. Now, examining you, I don't think your thyroid gland is active at the moment. You're already on treatment for it. So, things seems to be quite stable at the moment. So what we'll do is we'll just do some thyroid function test to make sure that they are within range, and we'll just keep you under review. Was there anything you wanted to ask me, or?
No, I'm quite happy with it as it is at the moment.
You are quite happy, yeah. Okay, thank you.
Could you give us your diagnosis and findings for Mr. Ashes?
Diagnosis for this patient is Graves' ophthalmopathy with current euthyroid status. On examination, this patient has got exophthalmos. There is no evidence of lid lag or lid retraction. He's got a thyroidectomy scar. There are no signs of hyperthyroidism. His thyroid status is euthyroid. There is no evidence of tachycardia or tremors of the outstretched hands. There is no proximal muscle weakness. I would like to investigate this patient further by doing a thyroid function test.
Could you describe for us the non-thyroid causes of exophthalmos?
The non-thyroid causes of exophthalmos can be a cavernous sinus thrombosis, retroorbital tumors, keratoconus fistulas, and sometimes orbital cellulitis can cause exophthalmos. Eye examination is a very common station. Patients with exophthalmos will be evident on first inspection. In these cases, we have to closely look at the neck, looking for any thyroid scars, because they can be very faint, and you have to put the scar in the context of patients. If the patient has signs of hyperthyroidism or they are euthyroid. Any patient with exophthalmos and thyroidectomy scar might be euthyroid but have had Graves' disease in the past, which is now treated. So it's important to look that It's also important to follow the routine of looking for lymphadenopathy, looking for thyroid bruise, retrosternal extension, and check the extraocular movements and demonstrate lid lag and lid retraction. Signs for hyperthyroidism should be looked at in the form of tremors, tachycardia, sweating, and proximal muscle weakness.